Hello everyone, I am Dr. Mahalakshmi, educator, forensic medicine and toxicology. Now in this video, we are going to see about animal poison. This is very important topic. Like for UG, you will definitely get some question from toxicology and most probably that question will come from this animal poison or it will be from heavy metal poisons. You will definitely get some sort of question. A 2 mark or 5 mark will definitely come from these two chapters. So in animal poisoning, we are starting with snake bite. So snake bite, around there are 3500 species all over the world there is, and amongst these we have only 330 species in India, and amongst this 330 only 70 that is venomous, that only 70 that can actually cause danger. All others are non-venomous. So whenever a snake bite comes to you, you have to make sure whether it was a venomous snake bite or non-venomous snake bite. And by just anybody getting snake bite, they will get very much agitated. And only because of that agitation and that thing, that fear itself will kill the person more than that venom. So you have to make sure whether it is a venomous snake bite or non-venomous snake bite. If they come along with the snake, you will be able to appreciate a bit more. So how will you differentiate between a venomous and non-venomous snake? We will see. If it is a venomous snake, you will have triangular shaped head and the head scale, it will be small. And they will have these elliptical pupil. You just remember for one and forget the other. That's how you will be able to correctly produce in the exam. So here it will be triangular. Opposite to that it will be rounded in case of non-venomous. And here head scale will be small. Here it will be large. So your head scale will be large here. And pupil will be elliptical here and here it will be rounded, and they have these fangs. This is very important, but here there will not be any fangs. They will simply have rows of teeth. Only this will be available in their mouth, and they will also have this venom gland. The poisonous gland is modified salivary gland which releases the venom. This will be present here and here it will be completely absent. And here they have their belly scale which is larger because they have to hold lot of poison, right? So their belly scale would be larger, while here the belly scale would be smaller. You have a small belly scale, and the anal plate, it will be single row and here it will be double row. So this is the main difference between a venomous snake and non-venomous snake. And apart from this venomous snake, it will be dull colored and they will be vibrantly colored. You will have vibrantly colored snake. Apart from that, it will is diurnal. Like it can come in morning, evening, any time, but this is mostly nocturnal. This will come out to eat only at the night time. So this is the basic difference between venomous and non-venomous snake. This is important, they will ask. So you can say the head scales, size of the head and the shape of the pupil. Then you can talk about the fangs and teeth. Then you can talk about the belly scale and the anal plate. So all these are the differences between venomous and non-venomous snake. So even if people come along with the snake, you will be able to identify whether it is a venomous or non-venomous snake. So mostly these are non-venomous snake. You can see like they will be large, stout, and they will be vibrantly colored. All these are non-venomous snake. All these, boa constrictor, everything, it is a non-venomous snake. And this venomous snake, when we come to your venomous snake, you mainly get 4 things in our country. You have the vipers, saw scale vipers and Russell viper. Then you have cobra, then you have the Krait. So these are the 4 types of snake that is commonly seen in our country, and we call them as the big 4 of India. All the snake bites, like more than 90% of the snake bite, of all the snake bite, more than 90% of the snake bite will be caused by any of these 4 snakes alone. So we call them the big 4 snakes of India. So you should be able to identify these snakes also. So if they come with this snake in hand, you should be able to identify whether it is a viper or a cobra or Krait. So how will you identify this? First we will start with the cobra. So cobra you will be able to identify with the spectacle mark in the hood. Have the spectacle mark in the hood. This is the only snake that comes with the hood. It will like open up, the head will open up forming a hood, and it will have spectacle mark. If the spectacle mark is absent, then it is king cobra. It will have hood, but in that hood the spectacle mark would be absent. So if spectacle mark is present, it is Indian cobra. It is absent, it is king cobra. And king cobra is far dangerous than Indian version. And here you can see third supralabial scale touching the eye and nasal shield. So here this is 1, 2, 3. This third scale will be larger and it will touch both nasal and eye shield. Like here it is touching the nose and here it is touching the eyes. So this third supralabial scale will be larger. So using this you will be able to identify cobra. And their teeth, their fang, it will be fixed and front fang. The fang will be present in the anterior part and it will be fixed. It will not retract. So it will be fixed there. So this is about cobra. So cobra, spectacle mark, hood and third supralabial being the largest, you will have a front fixed fang. This is how you will identify cobra. Now you have the viper. So viper, mostly they will have this triangular shaped head. So viper will come with triangular shaped head. You have lots of vipers, saw scale viper, Russell's viper, pit viper, like that you have lot of vipers, but all the vipers they will have this triangular shaped head. And this triangular shaped head with 3 rows of diamond shaped spots over the back. Like they will have triangular shape like this, like it will be in 3 rows over their back, you will be able to see. So if it is there, it is Russell's viper. If only central row of diamond shape is there, it is saw scale viper. So saw scale viper, it is saw, it will have only 1 row of diamond, so it is saw scale. Russell's viper, it will have 3 rows of this diamond over their back. And if you have pit like this near the nose, it is pit viper. You will have pit viper like this. And how will you identify Krait is that over their back they will have this hexagonal shaped scales in their dorsum. In the middle of the dorsum you will be seeing this hexagonal shaped scales, and they will also have this infralabial scale largest. Cobra, third supralabial was largest. Here in Krait, the fourth infralabial will be largest. So this is how you differentiate which snake is, whether it is viper or cobra or Krait. So now when somebody comes to you along with the snake, you should be able to identify whether it is a venomous or non-venomous. If it is venomous, whether it is a viper or cobra or Krait. Why we have to identify is that each and every snake present with different manifestation. You see here this, do you see this tail? It is looking like a paddle. So this is a paddle shaped tail. And this is a sea snake. And the sea snake, it will cause mainly myotoxicity. So that will be the presentation of this snake. So this sea snake, they live primarily in the water, but they don't have gills and all. They have to come occasionally to the surface to respire and they will go back. So this sea snake, if it is bitten, then you will be getting different manifestation. Viper will have hematotoxic manifestation. Cobra and Krait, they will have neurotoxic manifestation. Like that, each and every snake manifestation will differ and you have to treat accordingly. So you have to know which snake caused which bite. So like that we have to understand. Now we will come to the snake venom. So snake venom is nothing but your saliva. It has become toxic by the modified parotid gland. This parotid gland, this will modify the saliva into very, very toxic material. That is what snake venom is. And in neurotoxic venom, on almost all the venom, you will be getting 90% of polypeptides and proteins. Most of the toxins, they will have protein. They will have enzymatic, non-enzymatic compounds, but most of them, 90% of them will be protein and polypeptide in nature. And if it is a neurotoxic venom, you will have two types. One is postsynaptic, another is presynaptic. Postsynaptic venom are this bungarotoxin and Cobra toxin. Presynaptic is beta bungarotoxin and Cobra toxin. So this is the postsynaptic neurotoxic venom and presynaptic neurotoxic venom. Then apart from this, you will have ATPase. You will have proteolytic enzymes. All this will result in the tissue destruction. It will lead to tissue destruction. You will have some hydrolases. Then you will have these procoagulants. In the vasculotoxic venom, you will mainly have these venom procoagulants, which will lead to increased activity of the fibrin and resulting in DIC. So you will have proteases, these RVVX and RVV5, hydrogenase and hydrolases. Everything will lead to increased hemorrhage. So increased hemorrhagic manifestation. This is what you will get in the venom. Because of this enzyme and non-enzymatic compounds, you will be experiencing all the symptoms. In neurotoxic venom, they will act presynaptically and postsynaptically. They will have procoagulant components leading to increased hemorrhagic manifestation. And ophitoxemia is snake poisoning. Like all the symptoms that you get because of a snake bite, that is ophitoxemia. And which is the most venomous snake among these four is, first is your Krait. You have your Krait, Russell's viper, then Cobra, then finally saw-scale viper. Like this most venomous, it depending upon the how much venom is required, how much quantity is required to cause lethal action. Depending upon that, only few ml of Krait venom is enough to cause lethality when compared to Russell, Cobra and saw-scale viper. So this most venomous, if they ask, it is Krait. And bite, whenever they bite, mostly it will be dry bite. Even if it is a venomous snake, it will not inject venom all the bites. So sometimes it will do dry bite. Sometimes it can be a protective bite. That is, the bite will be made over your hard surface, over your slipper or over your jeans, something like that. It will be striking over some protective layer. So injection of the venom would not have happened. So this protective bite may also happen. So you have to properly analyze whether bite was happened by venomous snake or not. It is a dry bite or not. Sometimes you will not see any manifestation. Even in protective bite, even if it is a venomous snake, you will not be able to see any manifestation. But the people will panic. That panic will lead to lot of tension and they may die because of this panic only. So you have to make sure the first thing is reassurance. So first time you have to reassure. Whenever you come across a case, first foremost thing is reassure. Then you have to immobilize. You have to immobilize, like whichever part, if it is the leg, you have to immobilize the leg. And then what you have to do is get to hospital. So this is the first aid. First reassure, immobilize, get to the hospital. Then there are some people who will advise doing tonic. This tonic, it is usually avoided. Why? Because this tight tonic, if it is a, especially if it is a vasculotoxic snake, you will get gangrene. Multiple local complication you will be getting in this vasculotoxic bite. So this tight tonic should be avoided. What you can do is this. This is known as Sutherland wrap. This will not be tight. This will obstruct only the lymph supply. Only the lymph supply will be affected by the Sutherland wrap. So even if it is vasculotoxic snake, you will not be seeing any local gangrenous changes. So what happens is that apart from this gangrenous changes, when you open the tourniquet, there will be sudden influx of venom into the systemic circulation. Because of that also, people may go into anaphylaxis and die. So tonic is usually avoided, and if you have to do tonic, you have to do a very like loose tonic where only the lymphatic supply is obstructed, not the blood circulation. So first aid, you have to reassure, immobilize, and then you have to get them to the hospital. Tonic is usually avoided. So next, what are the signs and symptoms? If it is a vasculotoxic, you will have hemorrhagic manifestation. You will mainly have hemorrhagic manifestation. So first, local sign. There will be significant local changes in vasculotoxic bite. So you will start from this. You will have these blister. It will become edematous. Then there will be lot of swelling and consistent bleeding from the site. So everything will happen, and even it may go to gangrene. So local changes will be very, very prominent, and there will be systemic bleeding. You will be seeing bleeding everywhere, like intracranial, everywhere there will be bleeding, because there will be over activation of the fibrin system, and there will be DIC, and all the hemorrhages will be happening all over the body. And if it is a myotoxic snake, what will happen is that you will not be able to see any bite mark. Like bite mark, it will be very, very rare, and it is like you will not experience any symptom. No symptom of bite. But later on, they will start feeling this trismus. Then they will feel fatigue, headache, and it will progress to muscular spasm, finally resulting in renal failure and death. So the snake bite, it will mainly go affect the muscle. This will lead to myoglobinuria. There will be myoglobinuria, which can result in renal failure and death. So this is about myotoxic snake. In case of neurotoxic snake, what will happen is that you will not see any local change. There will be no local changes. But systematically, you will have facial muscle weakness. It will start from the facial muscle, then it will go down to neck, then finally respiratory arrest will happen. There will be dyspnea, there will be dysphagia, all the muscle, it will go into paralysis. So in neurotoxic, there will be no local sign, only this neuromuscular symptoms will be seen. Mainly there will be weakness and paralysis of the muscle. So this is about neurotoxic symptoms. So whenever they come to you, what you can do is, from the history you can diagnose. If not, you can do certain lab tests. You can order for radioimmunoassay of the venom. By using this, you can identify snake bite. Or what you can do is, if they have significant local manifestation, you can suspect vasculotoxic, and you will do whole blood clotting test. So you will take blood in a glass vial. You will take blood in a vial and you will leave it just like that for 10 minutes. Without disturbing it, you will leave it. And even after 10 minutes, if it is fluid, then it proves there is snake bite. That too, vasculotoxic snake bite. So this is how you will diagnose vasculotoxic. If it is neurotoxic, you will look for the muscular weaknesses. You will look for ptosis. You will look for any dysphagia. You will ask them to hold their breath and count. You will do single breath counting test. How much they are able to control their muscles. So all these muscular activity you will be checking. If they are failing those tests, then you can suspect neurotoxicity. And all the treatment is, all the snake bites, you have only one treatment, that is ASV, anti-snake venom. So what you have to do is, it is in a powder form. So it will be given in a powder form. You have to add it to the distilled water and you have to make a solution and you have to give it to the patient. There is more chance for anaphylaxis, but still this is the only way to treat snake bite. So this is what you will do. After that, what you can do is, you can start antibiotic and TT. So this is what you can do, and symptomatic management. This is the main mode of treatment in case of snake bite. And whenever you start ASV, you have to make sure there is some positive finding. Only in positive finding you will be starting ASV, because it is highly dangerous. People can even die because of anaphylaxis. So only after you are sure that it is a snake bite, only if you see a significant local change like swelling or consistent bleeding, or you are seeing any muscular weakness, then only you should be starting this anti-snake venom. Without that, you should not start. And in certain neurotoxic bite like cobra bite, neostigmine is useful. So this neostigmine can help counteract the neurotoxicity of the cobra bite, but it is not useful in Krait. It is not useful in Krait. So these are the important modalities of treatment. So snake bite, first aid, what you have to do, and what are the tests you will be doing, what are the symptoms they will be presenting with. If it is a vasculotoxic, what will be there? If it is a myotoxic, what will be there? Neurotoxic, what will be there? And what is the treatment? And when will you start the treatment? This is all important. So snake bite, mostly they will be asking you what are the manifestation and what are the different types of snakes that you will be finding, differences between venomous and non-venomous snakes. This is most importantly asked, and this is one of the most accidental bite you will be happening to see in the agriculture areas. So next what we are going to see is scorpion bite. So scorpion bite, this is the stinger. This is known as telson. This is where the venom is located. So whenever there is a scorpion bite, what will happen is there will be neuronal sodium channels activation. Because of that, there will be overactivation of sympathetic and parasympathetic system. In sympathetic activation, you will be experiencing pain, increased heart rate, which can progress to arrhythmia. In parasympathetic, you will be seeing vomiting, sweating, increased salivation, and priapism. So all these are common with scorpion bite. So scorpion bite, whenever they come, there will be extreme pain. They are more prone for hypertension and arrhythmia, and parasympathetically there will be increased sweating, salivation, and priapism may also happen. And whenever this happens, the main mode of treatment is Prazosin. Prazosin is the drug of choice. It is an alpha blocker. It will help in the treatment of scorpion bite. Next, what you can have is Spanish fly. It is also known as blister beetle. So this blister beetle, what it has is, it has one active principle known as Cantharide. So this Cantharide, it will go inhibit proteases. Because of that, there will be renal failure. So this can cause renal failure, and this can also cause priapism, and when ingested it can cause GI irritation. So all these are caused by the Spanish fly, and this Spanish fly, it is used as an aphrodisiac. Aphrodisiac. So because of that, this poisoning can happen, and this Cantharide, it is seen in all the fluids in its body. So whenever you crush it, even then the fluid will come out, and Cantharide, it will come and touch your skin. You will have corrosive action. You will have erosion of the skin because of this Spanish fly. So the other name is blister beetle or Spanish fly. It has this Cantharide as active principle, which mainly inhibits proteases, leading to renal failure and death. It can also cause priapism and GI irritation when ingested. Next is this box jellyfish. This is the most venomous animal in the world. So this is the most venomous, and when it bites, you will not be feeling anything, but after some time you will start feeling adrenergic overactivity. Like another differential diagnosis, pheochromocytoma. So all the adrenogenic activity, adrenogenic overactivity will happen and eventually there will be death. There is no definitive treatment for this. Mostly symptomatic treatment is done. So this is the most venomous animal, box jellyfish. So in animal bite, the main thing that you have to know is snake bite, scorpion bite and Spanish fly. So how it acts, what is the different types of snake, everything is important to remember for exams. So with this, we are concluding this video. Thank you for watching.